Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about HIV transmission. So today we will discuss the modes of transmission of HIV. HIV can be transmitted via the exchange of variety of body fluids from people living with HIV, such as blood, breast milk, semen, and vaginal secretions. HIV can also be transmitted during pregnancy and delivery to the child. People cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, or sharing personal objects like food or water. It is important to note that people with HIV who are taking medications for HIV and have undetectable viral load do not transmit HIV to their sexual partners. Early access to therapy of HIV and support to remain on treatment is therefore critical, not only to improve the health of people with HIV, but also to prevent HIV transmission. So, risk factors like behaviors and conditions that put people at greater risk of contracting HIV include having condomless anal or vaginal sex, having another sexually transmitted infection such as syphilis, herpes, chlamydia, also gonorrhea, and bacterial vaginosis. So, engaging in harmful use of alcohol and drugs in context of sexual behavior, sharing contaminated needles, syringes, and other injecting equipment and drug solutions when injecting drugs, receiving unsafe injections, blood transfusions, and tissue transplantation, and medical procedures that involve unsterile cutting or piercing, and experiencing accidental needle stick injuries, including among health workers. HIV is not spread by air or water, mosquito, ticks, or other insects. Also, do not transfer by saliva, tears, sweat, feces, or urine that is not mixed with the blood of a person with HIV. So, by mosquito, ticks, or other insect, also through saliva, tears, or sweat, by hugging, shaking hands, sharing toilets, sharing dishes, or close the mouth, or social kissing with someone who has HIV. All these methods do not transmit HIV. Through other sexual activities that do not involve exchange of body fluids, for example, touching, all this do not transmit HIV. HIV, how it is not transmitted, the following are ways the virus is not spread: kissing, touching, social kissing, and hugging pose no risk of transmission. Also, being sexual with someone without exchanging infected body fluids does not spread the virus. The only time deep kissing is risk is when the person infected with the HIV has open sores or oral bleeding. Also, sharing living space, any casual contact with someone who has HIV, including sharing bathroom, is safe. However, we advise the patient not to share razor blades, or toothbrushes. If someone who is infected nicks himself while shaving or has bleeding gums, it could increase the risk of transmission. Sharing food or utensils, the virus cannot survive on surfaces or sharing utensils and other household items will not spread HIV. You can share meal with someone who is infected without worry. Transmission has been very rarely associated with mothers breech-showing food for their babies when infected. Blood from mouth mixes with the food, known as pre-mastications. It is common practice in Africa, but not typically done in the United States or Europe. Saliva, sweat, or tears. An infected person's saliva, sweat, and tears do not put you at risk. Helping an injured person with HIV wearing gloves while doing so is ideal, but even if the person's blood come into contact with your intact skin, you should not worry. We do not consider blood exposure to intact skin to be risk. There is need to be cut or abrasion to allow the virus to get past the skin layer. Water fountains. Sipping from water fountain after someone who has HIV used it is considered casual contact and will not lead to transmission HIV. As regard the human immunodeficiency virus is an infection that attacks the body immune system. Acquired immune deficiency syndrome is the most advanced stage of the disease. HIV targets the body white blood cells, weakening the immune system. This makes it easier to get sick with disease like tuberculosis, infections, and some cancers. HIV is spread from the body fluids of an infected person, including blood, breast milk, semen, and vaginal fluids. It is not spread by kisses, hugs, or sharing food. It can also spread from a mother to her baby. HIV can be treated and prevented with antiretroviral therapy. Untreated HIV can progress to AIDS. So I will leave my WhatsApp. If any person want to send medical report or any complaint or any question, so my WhatsApp is 00201027284778. Thank you very much.